We start with new action plans unveiled by a special healthcare reform committee. First up is the launch of a special discussion body consisting of doctors, nurses, and patients to figure out the appropriate number of future doctors. Shi-hoo has this report.
The South Korean government is taking its first steps to reform the nation's healthcare system, one of the key areas of the Yoon administration's 4+1 reform plans. On Friday, the Special Presidential Committee on Healthcare Reform announced that it's launching a discussion body of doctors, nurses, patients, and professionals from other relevant sectors to come up with a reasonable estimate of the supply and demand of doctors based on scientific evidence and public acceptance.
We plan to launch the discussion body this year so that we can carry out mid to long-term policies considering future healthcare demands.
If, in the process, the doctors provide a rational alternative to the government's current plans for medical school enrollment quota increase, the government says they could potentially discuss the quota for year 2026 admissions with the doctors. The 2026 quota has not yet been finalized amid disputes between the government and doctors who oppose the increase. Further efforts will be made to provide better working conditions for trainee doctors by shortening their standard working hours from the current 80 per week to 60 by the year 2031. Starting next year, the hours will be decreased to 72. Other plans include changing hospital structures so that larger facilities can focus on patients in critical conditions. All this while the government drastically increases its financial input.
Over the next 5 years, we'll put in more than 20 trillion won in intensive support of medical care reform.
The money will be allotted for medical training and R&D, essential care services, and to help those going through medical malpractice or accident disputes. Back in February, the government announced a package of medical policies, including the medical school enrollment size increase from 3,058 students a year to 5,058 in its plans to yield up to 10,000 new doctors by 2035. Since then, those in the field, especially medical students and doctors in training, have gone on leave, causing a significant shortage of medical personnel in essential and emergency care. Shi-hoo, Arirang News.